Hi students, welcome to lesson number 22 on National Policy for Persons with Disabilities and Aged. The introduction for the lesson. Old age and disabilities are considered to be constraint on healthy existence of human beings. So, people belonging to this category are vulnerable. To cater this problem, the National Policy for Persons with Disabilities was adopted in 2006. It recognizes that persons with disabilities are a valuable human resource for the country and seeks to create an environment that provides them equal opportunities, protection of their rights and full participation in society. The policy emphasizes upon the fact that a majority of persons with disabilities can lead a better quality of life if they have equal opportunities and effective access to rehabilitation measures. And there is another policy for the old person which was announced in 1999 to reaffirm the commitment to ensure the well-being of the older persons. The policy envisages state support to ensure financial and food security, health care, shelter and other needs of older persons, equitable share in development protections against abuse and exploitation and availability of services to improve the quality of their lives. And the objectives of these lessons are that the students will be able to recall the problems of the disabled and the aged. They can know about the rights of these vulnerable groups and they can critically relate the information on rights of these groups to our surrounding and for an appropriate action. Now, let us try to understand the National Policy for Persons with Disabilities 2006. The Government of India formulated the National Policy for Persons with Disabilities in February 2006, which deals with physical, educational and economic rehabilitation of persons with disabilities. In addition, the policy also focuses upon rehabilitation of women and children with disabilities, barrier-free environment, social security, research and other aspects. Now, we look into the focus of this policy. The focus of the policy is on the various aspects. And the first one is prevention of disabilities. Since disability in a large number of cases is preventable, the policy lays a strong emphasis on prevention of disabilities. It calls for program for prevention of disease which result in disability and the creation of awareness regarding measures to be taken for prevention of disabilities during the period of pregnancy and thereafter to be intensified and their coverage is expanded. Second is rehabilitation measures. Rehabilitation measures can be classified into three distinct groups, and the first one is physical rehabilitation, which includes earlier detection and intervention, counseling and medical interventions and provision of aids and appliances. It will also include the development of rehabilitation professionals. Second, it is educational rehabilitation, which includes vocational education. And the third one is economic rehabilitation for a dignified life in society. Third aspect is women with disabilities. Women with disabilities require protection against exploitation and abuse. So, special program will be developed for education, employment and providing of other rehabilitation services to women with disabilities, keeping in view their special needs. Special educational and vocational training facilities will be set up. Therefore, the programs will be undertaken to rehabilitate abandoned disabled women or girls by encouraging their adoption in families, support to house them and impart them training for gainful employment skills. The government will encourage the projects where representation of women with disabilities is ensured at least to the extent of 25% of total beneficiaries. Another focus is on children with disabilities. Children with disabilities are the most vulnerable group and need special attention. The government would strive to first ensure right to care, protection and security for children with disabilities. You also try to ensure the right to development with dignity and equality, creating an enabling environment where children can exercise their rights, enjoy equal opportunities and full participation in accordance with various statutes. Third, it ensures inclusion and effective access to education, health, vocational training along with specialized rehabilitation services to children with disabilities. Fourth, it also ensures the right to development as well as recognition of special needs and of care and protection of children with severe disabilities. Fifth focus is on barrier-free environment. Barrier-free environment enables people with disabilities to move about safely and freely and use the facilities within the built environment. The goal of barrier-free design is to provide an environment that supports the independent functioning of individuals so that they can participate without assistance in everyday activities. Therefore, to the maximum extent possible, buildings, places, transportation system for public use will be made barrier-free. Sixth focus is on issue of disability certificates. The Government of India has notified guidelines for evaluation of the disabilities and procedure for certification. The government will ensure that the person with disabilities obtain the disability certificates without any difficulty in the shortest possible time by adoption of simple, transparent and client-friendly procedures. Seventh focus is on social security. Disabled persons, their families and caregivers incur substantial additional expenditure for facilitating activities of daily living, medical care, transportation, assistive devices, etc. Therefore, there is a need to provide them social security by various means. Central government has been providing tax relief to persons with disabilities and their guardians. The state governments, the union territories, administrations have been providing unemployment allowances or disability pension. The state governments will be encouraged to develop a comprehensive social security policy for persons with disabilities. And the eighth focus is on promotion of non-governmental organization, that is the NGOs. The national policy recognizes the NGO sector as a very important institutional mechanism to provide affordable services to complement the endeavors of the government. The NGO sector is a vibrant and growing one. It has played a significant role in the provisions of services for persons with disabilities. Some of the NGOs are also undertaking human resource development and research activities, and the government has also been actively involving them in policy formulations, planning, implementation, monitoring, and has been seeking their advices on various issues relating to persons with disabilities. Interaction with NGOs will be enhanced on various disability issues regarding planning, policy formulation and implementation. Networking, exchange of information and sharing of good practices amongst NGOs will be encouraged and facilitated. Steps will be taken to encourage and accord preference to NGOs working in the undeserved and inaccessible areas. Reputed NGOs shall also be encouraged to take up research projects in such areas. And the ninth focus is on the collection of regular information on persons with disabilities. So, there is a need for regular collection, compilation and analysis of data relating to socio-economic conditions of persons with disabilities. The National Sample Survey Organization has been collecting information on socio-economic conditions of persons with disabilities on regular basis once in 10 years since 1981. The census has also started collection of information on persons with disabilities from the census 2001. The National Sample Survey Organization will have to collect the information on persons with disabilities at least once in 5 years. The differences in the definitions adopted by the two agencies will be reconciled. The 10th focus is on the research. For improving the quality of life of persons with disabilities, research will be supported on the socio-economic and cultural context, cause of disabilities, early childhood education methodologies, development of user-friendly aids and appliances, and all matters connected with disabilities which will significantly alter the quality of their life and civil society's ability to respond to their concerns. Wherever persons with disabilities are subjected to research intervention, their family member or caregiver's consent is mandatory. And the 11th focus is on sports, recreation and cultural life. The contribution of sports for its therapeutic and community spirit is undeniable. Persons with disabilities have right to access sports, recreation and cultural facilities. The government will take necessary steps to provide them opportunity for participation in various sports, recreation and cultural activities. Now, we look into the National Policy for Senior Citizens or Aged 2011. The foundation of the new policy, known as the National Policy for Senior Citizens 2011, is based on several factors, and these include the demographic explosion among the elderly, the changing economy and social milieu, advancement in medical research, science and technology, and high levels of destitution among the elderly rural poor, which constitute 51 million elderly live below the poverty line. A higher proportion of elderly women than men experience loneliness and are dependent on children. Social deprivations and exclusion, privatization of health services and changing pattern of morbidity affect the elderly. All those of 60 years and above are senior citizens. This policy addresses issues concerning senior citizens living in urban and rural areas, special needs of the oldest to old and older women. In principle, the policy values an age-integrated society. It will endeavour to strengthen integration between generations, facilitate interaction between the old and the young, as well as strengthen bonds between different age groups. It believes in the development of a formal and informal social support system, so that the capacity of the family to take care of senior citizens is strengthened and they can continue to live in the family. The policy seeks to reach out in particular to the bulk of senior citizens living in rural areas who are dependent on family bonds and intergenerational understanding and support. Now, what is the focus of the policy? The focus of the policy is the first one, to mainstream senior citizen, especially older women, and bring their concerns into a national development debate with priority to implement mechanisms already set by governments and supported by civil society and senior citizens association. Support promotion and establishment of senior citizens association, especially amongst women. It also tried to promote the concept of aging in place or aging in own home, housing, income security and home care services, old age pension and access to health care insurance schemes and other programs and services to facilitate and sustain dignity of the old age. The thrust of the policy would be preventive rather than cure. The policy will also consider institutional care as the last resort. It recognizes that care of senior citizens has to remain vested in the family, which would partner the community, government and the private sector. It also focuses on being a signatory to the Madrid Plan of Action and barrier-free framework. It will work towards an inclusive, barrier-free and age-friendly society. It also recognizes that senior citizens are a valuable resource for the country and create an environment that provides them with equal opportunities, protect their rights and enables their full participation in society. And towards the achievement of this directive, the policy visualizes that the states will extend the support for senior citizens living below the poverty line in urban and rural areas and will also ensure their social security, health care, shelter and welfare. It will protect them from abuse and exploitation so that the quality of their lives also improves. It also focuses on long-term savings, instruments and credit activities will be promoted to reach both rural and urban areas. It will be necessary for the contributors to feel assured that the payments at the end of the stipulated period are attractive enough to take care of the likely erosion in purchasing power. It also focuses on the employment in income generating activities after superannuation will be encouraged. It also support and assist organizations that provide counseling, career guidance and training services. The states will be advised to implement the Maintenance and Welfare of Parents and Senior Citizens Act 2007 and set up tribunals so that elderly parents unable to maintain themselves are not abandoned and neglected. The state will set up homes with assisted living facilities for abandoned senior citizens in every district of the country and there will be adequate budgetary support. Areas of interventions of this policy. The concerned ministries at central and state level as mentioned in the implementation section would implement the policy and take necessary steps for senior citizens. And it comes under first one, income security in old age, that is a major intervention required in old age which relates to financial insecurity as more than 2/3 of the elderly live below the poverty line. It will also increase with age uniformly across the country. Second intervention is public distribution system, wherein the public distribution system will reach out to cover all senior citizens living below the poverty line. Third intervention is on income tax. Taxation policies would reflect sensitivity to the financial problems of senior citizens which accelerate due to very high cost of medical and nursing care, transportation and support services which are needed at homes. Fourth intervention is on microfinance, wherein loans at reasonable rates of interest would be offered to senior citizens to start small businesses, or microfinance for senior citizens would be supported through suitable guidelines issued by Reserve Bank of India. Fifth is on health care. With advancing age, senior citizens have to cope with health and associated problems and some of which may be chronic, of a multiple nature, require constant attention and carry the risk of disability and consequent loss of autonomy. Some health problems, especially when accompanied by impaired functional capacity, require long-term management of illness and nursing care. Healthcare needs of senior citizens will be given high priority. The goal would be good, affordable health service heavily subsidized for the poor and a graded system of user charges for others. It would have a judicious mix of public health services, health insurance, health services provided by not-for-profit organizations including trusts and charities and private medical care. Sixth intervention is on safety and security. Provisions will be made for stringent punishment for abuse of the elderly. Abuse of the elderly and crimes against senior citizens, especially widows and those living alone and disabled, would be tackled by community awareness and policing. Police would be directed to keep a friendly vigil and monitor programs which will include a comprehensive plan for security of senior citizens whether living alone or as couples. They would also promote mechanisms for interaction of the elderly with neighborhood associations and enrollment in special programs in rural and urban areas. Protective services would be established and linked to helplines, legal aid and other measures. Another intervention, that is the seventh one, is on housing. As you all know, the shelter is a basic human need. The stock of housing for different income segments will be increased. 10% of housing schemes for urban and rural lower income segments will be earmarked for senior citizens. This will include the Indira Awas Yojana and other schemes of the government. Another is on the welfare aspect. A welfare fund for senior citizens will be set up by the government and revenue generated through social security cess. The revenue generated from this would be allocated to the states in proportion to their share of senior citizens. States may also create similar funds. Non-institutional services by voluntary organization will be promoted and assisted to strengthen the capacity of senior citizens and their families to deal with the problems of aging. All senior citizens, especially widows, single women and the oldest to old, would be eligible for all schemes of the government. They would be provided universal identity under the Aadhaar scheme on priority. Larger budgetary allocation would be earmarked to pay attention to the special needs of rural and urban senior citizens living below the poverty line. Now, we will know the establishment of National Council for Senior Citizens. A National Council for Senior Citizens headed by the Minister for Social Justice and Empowerment will be constituted by the ministry. With tenure of 5 years, the council will monitor the implementation of the policy and advise the government on concerns of senior citizens. A similar body would be established in every state with the concerned minister heading the State Council for Senior Citizens. The council would include representatives of relevant central ministries, the Planning Commission and 10 states by rotation. Representatives of Senior Citizens Association from every state and union territory, representatives of NGOs, academia, media and experts on aging. The council would meet once in 6 months. Now, who are responsible for the implementation? The Ministries of Home Affairs, Health and Family Welfare, Rural Development, Urban Development, Youth Affairs and Sports, Railways, Science and Technology, Statistics and Program Implementation, Labour, Panchayat Raj, Road Transport and Highways, Public Enterprises, Revenue, Women and Child Development, Information Technology and Personnel and Training will set up necessary mechanism for implementation of the policy. A 5-year perspective plan and annual plan setting targets and financial allocations will be prepared by each ministry department. The annual report of these ministries departments will indicate progress achieved during the year. This will enable monitoring by the designated authority. To summarize, in this lesson, we have discussed the situation of the aged and the disabled. These people also have a right to lead a life of dignity. And in the first section, we have discussed about the problems of the disabled, wherein disability can be experienced in various ways. Not only is it strictly anatomic or physical, but mental as well. And in this section, the term disability itself has been discussed since it covers a whole range of disabilities. Depending on the specific disabilities that a person suffers from, specific measures can be taken to help them to lead a normal life. In another section, we have talked about the elderly, wherein the 21st century has been characterized as a graying dawn, which means that there is going to be an increasing number of older people, comparatively speaking. You can easily guess that with these increasing graying population and dwindling support system, the situation is likely to grow alarming very soon. There have been various attempts by the state and the other civil bodies to attend to these problems. In this lesson, we have attempted to look at some of the various issues about the elderly and the disabilities, and wherein the various provisions, policy measures and rights of the older people and disabilities in India. We have examined some of the declarations, conventions and bodies which address the problems of the displacement. We hope that as an individual seeking information on human rights, you will analyze the situation of these vulnerable groups in their respective contexts and critically evolve strategies to help them fight for their rights. This is possible wherever you may be if you have concern for fellow human beings and an interest to help.